Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Bulletin Beat. This audio podcast as part of a Squadron Bloca. This audio podcast as part of a POC Robotics, and this audio podcast as part of a Storm Robotics production. And this this audio podcast is a sort of an interlude as part of this audio podcast series. and so as part of this as part of the audio podcast series, as part of the audio podcast series, a little bit in around some a little bit in around answering some specific sort of questions. So one of the questions as part of the series was as part of the audio podcast series, but also as part of original drafted works was number one, to understand what further aspects of transfusion care and around transfusion practices are required for patients or recipients with long-standing conditions, long-term conditions, or chronic illnesses. Number two, to highlight what specific sort of practices would help in the development of transfusion care guidelines, and three, to provide an understanding of sort of treatment alternatives, taking into consideration renal insufficiency. So in around number one, healthcare professionals, and healthcare sort of scientists apart from the transfusion practice and guidelines. Healthcare scientists make decisions based on sort of transfusion requests in front of them, and by acknowledging how a clinical team, for example, how clinical teams may be prompting, sort of propagating medical care, clinical sort of care for patients or recipients. However, at the same time, relating to part of this works, healthcare scientists or healthcare professionals should become acquainted with clinical and medical practices, but also in around sort of laboratory reference ranges of diseases diseases, to also understand what forms of treatment or care would be best for those who may require RBTs, and in around clinical or medical care pathways. This also means that there has to be, or there should be more sort of multidisciplinary team efforts, MDT efforts, where members of the healthcare team communicate more frequently, and where healthcare scientists are more involved in for example, MDT. This would certainly also help meet sort of mutual objectives and inform sort of transfusion healthcare sort of practices. Number two on question two or part two, one of the other points in around this works was when thinking about what specific practices would help in the development of transfusion care guidelines. It's also important to to know what has worked from the literature and from the evidence, and what hasn't. So transfusion teams nowadays are certainly or have been sort of overworked owing to a sort of aging population, and to an extent there may be more issues honing down on specifics of best practice or best practices to inform guidelines, but more crucial is there needs to be more investigations, so practices become more sort of more centric for those suffering with those suffering and required sort of care in regard to RBTs or and or sort of alternative alternative sort of treatment modalities. At the same time, in line with this, phenotyping is one way that could help patients or recipients, and thus all NHS trusts or a National Health Service. The National Health Service needs to prompt or propagate in around into a sort of a main hub of what works and what doesn't when it comes to transfusion care for patients with long-standing conditions or long-term conditions and or chronic illnesses. At the same time, whilst laboratory medicine specialists utilize standard operating procedures, at the same time, the standard operating procedures, whilst are sort of part of sort of main guides in context of laboratory medicine practices. At the same time, number one around this is that the way certain transfusion care practices are informed by a laboratory specialist. For example, number one, that can be open to interpretation, and number two, owing to how specific sort of clinical practices are, or medical practices, or clinical practices, or medical practices are. For example, upon a request in regard to RBTs or red blood cell transfusion, request, for example. The second point, or point two around this, is that it can be down to a laboratory specialist discretion as to how an RBT request is sort of dealt with. Although although on the first sort of principle, one of the first main principles is that a laboratory specialist would have to deal with an RBT request, based on the request from a clinician or from a medical teams, for example. However, at the same time, there is scope, there is scope or part of practice in context of laboratory medicine, where it can be down to the laboratory specialist, or laboratory sort of practitioner in around whether to issue or question an RBT request. And so in on sort of point 3, there needs to be more evidence-based practices of what works and what doesn't, and in this context need to be linked into a hub, so that potentially sort of more novel guidelines can be produced, or can be organized, or can be produced. And so where leadership and management is concerned, healthcare scientists also need to be involved in raising awareness and providing sort of education to clinical and medical teams of the more intricate intricate aspects of laboratory practice or practices, and what in around highlighting what sort of treatment alternatives there are, and that will help preserve renal function over time. And it is at the same time, it is as if a laboratory specialist has to impart knowledge of some some aspects of pharmacological agents, as well as alternatives, but at the same time, if healthcare scientists or professionals within laboratory in amongst laboratory practices are generally informed, then it is important that healthcare professionals can and should be sort of involved in sort of decision making to help inform best practice or best practices. And consequently, although iron stores, and so predominantly, for example, ferritin, may be normal, the transport of iron either from iron stores to bone marrow is inhibited, so leading to a sort of a default sort of functional iron deficiency and subsequent anemia. And so healthcare scientists are sort of, again, in the game of saving lives. In the game of saving and sustaining lives. And so they should be supporting healthcare where lives are potentially being further, where lives are potentially being further compromised. That draws this audio podcast to a close. This audio podcast is part of a Bulletin beat. This audio podcast as part of a Squadron Bloca. This audio podcast is part of a POC Labonics, and this audio podcast as part of a Storm Robotics production.